Now call the Beaufort County Board of Commission meeting for November to order. I'd like to welcome everyone here tonight. Again, if you've got a cell phone, please either turn it off or put it into silence mode, if you would, please. At this time, I'd like to ask Vice Chairman Langley if he'll do our invocation, and I will do our pledge. Please stand with us.
Let us pray. Eternal God, our Father, we are grateful and thankful for the opportunity to come together one more time to do the business of this county. And Father, we just pray that we will have our priorities straight, you first and your people second, and then we ourselves. Help us, Father, to make wise and prudent decisions. In Jesus' name we pray. Amen.
We're down to conflict of interest. I want to make sure that if any commissioner has any kind of conflict with anything that's on the agenda tonight, to please let us know. Hearing none, we move forward. I need a motion to approve tonight's agenda.
So moved. Second.
All those in favor, please raise your right hand. Unanimous. It's approved. We're moving forward. We're down to public comments. Ms. Moat.
Thank you, Mr. Chairman. Is that on? Can you hear me? I have a few comments I need to make tonight. I've been thinking about this for a long time, and I hope I can get it done in 3 minutes. It's mostly about Hood. I've wanted to say this for a long time. I think tonight was the night to say this. I don't mean him any harm, and I want to commend him for the way he and his wife have raised his granddaughter. She's a wonderful young lady. That's being said, I have some complaints, Hood.
Point of order. Point of order is that we have rules that we operate under.
Right.
And you can't come in here and attack a commissioner. You've got newspapers for that. I've got my own newspaper. You're welcome to attack me in my own newspaper.
Correct.
But you can't do it here.
Yes.
And I mentioned his name because it has to do with a lot of things. But it seems that whenever things come up before the board,
Mr. Chairman.
there are always comments made derogatorily by
Mr.
individuals
Chairman,
on this board.
I have a free speech right. She is not allowed to do this under the rules. We stopped the personal attacks a long time ago. Now, I'm willing to sit here and let her mouth off, but when you let her mouth off, you're going to have to let everybody else in the county mouth off, too.
Sorry, Dot.
The comments that I'm going to make are repetitive comments.
Dot.
Yes.
Yeah. Sorry, you
Pardon?
would stop in the personal attacks, please.
Well, I would like to then comment about some of the comments that have been made at board meetings that are in the minutes of one of your meetings in December. Is that allowed?
Let's hear what you got to say.
Okay. It had to do with the jail committee, and I have not been at the last one of the board meetings, so I don't know if you selected a jail committee or not. But then again, it goes back to Mr. Hood. Maybe I better just say I'm not going to say anything, but I will pay to put an ad in the paper which will represent the same kind of thing that he has paid for to degrade and demean his own party, which is a shame and disgusting. He sent out postcards to a lot of Republicans, and I just wanted the public to know about that.
Thank you, Dot.
Thank you.
Doesn't understand the Second Amendment.
We're down to elected officials of those.
Is that the first amendment? Excuse me.
Think about it. I'll second.
All those in favor?
Mr. Chairman? Item number 6, I want to pull that for discussion.
Okay, we'll move that down to number 2 under A. Anything else? Motion to approve the amended agenda, consent agenda.
Second.
All in favor, raise your right hand. We're down to the health department. Mic on so you can hear. We're down to the health department and Mr. Jim Matson. He'll be here in just a second.
Hope everybody's doing well today. I'm going to talk to y'all a little bit about COVID and let you know that we are at 224 days since our first case in Beaufort County, and we're in our 8th month of the epidemic as far as activation of our EOC, things going on in Beaufort County around that. In North Carolina, we are at 278,000 confirmed cases, 4,390 deaths. Presently, there's 1,146 North Carolinians that are being hospitalized, and North Carolina's done over 4 million tests so far, and their positivity rate for today is 6.2. They're able to do theirs every day. We do ours once a week. In Beaufort County, we're at 1,451 confirmed cases, which is 3% of our population. Right now, today, we have about 125 active cases that we know of. There's, a lot of people that haven't been tested that have COVID, and I don't know the exact number, but some people estimate up to 3 people for every 1 case that we catch. We're at 47 deaths. We had 1 more today, and I have 6 that I'm investigating right now. By investigating, what I mean is I'm waiting for the death certificates to come in so I can look to see if the medical examiner or the physician really made it a COVID death. Out of the last 10, I've had 4 of them come back that were not COVID deaths, so I didn't include those. Last week, out of all the people that we tested, 8.2% of those that we tested were positive. This is down from a couple weeks ago where we were at 10%. We're currently investigating 2 outbreaks in the county. Both of those are long-term care facilities. One of those long-term care facilities is getting close to being done with an investigation, which means they go 14 days without any cases of positive cases. Then we follow them for 1 more 2-week period. That's the cycle of the disease. And then once they're at 28 days, then it's considered over with. So this slide I wanted to show you to show the number of virus that has been picked up in testing in the Sentinel site setting. So you can see the 3 curves from the COVID virus. So these are actual positive cases that were in the Sentinel site. This is about the only one I was going to include for the state for the most part today. This also includes flu, but you'll see the green line, which early on in the year, which is last March, I believe it was, and you saw it go down, and now it's at 0. I'll include this in future presentations so that you can see the flu rise as well as watching the COVID numbers. And that's important because I've had comments from a lot of people in the community that want to see the flu compared to the COVID. And I'll talk a little bit more about that later. So over the last 2 weeks in Beaufort County, We've had 191 cases, and that means our rate is 41 per 10,000 people. And then to compare how we did with the rest of the state, you can see that we fell in the second worst category for the last couple of weeks. So we did go through a period of high numbers. We actually went through 2 cycles, and I'll show you those in some of the graphs. I will say this much, that I think the last 7 to 10 days has been in a better trend. So most of this is probably due from right at 2 weeks ago when we were really at a high rate. Looking at some of the available resources in our region for Vidant, since they do most of our inpatient medical care in this area. You can follow their graphs. You can see the number of people that have been put into the hospital. It's the top bar. The middle bar is the number of people that have been put on ICU. And then the last one are those who have been actually had to have a ventilator in order to assist them with breathing. So this is not just for Beaufort County, but for the region around us. I wanted to spend most of the time going over some of the slides and graphs that I have on the website because of its availability for people. They can watch it and not have to wait every month or so to see the data. So this is the number as of today, where we've done over 19,500 tests in Beaufort County. Our residents have been tested. A certain percentage of them, probably around 3 to 5, are retest and stuff like that, but most people have been tested. Let's see, that equates to 41% of our population, is that right? Has been tested so far. Again, 1,451 positives, which is, as mentioned already, 3% of our population is tested positive. Out of all the 1,451, 5.3% or 77 have been hospitalized during this event, and we've had 47 deaths, which is 3.2% of all our positive cases. The average age of death is 79 and a half, so it is affecting our elderly. And then today we have 10 people that are in the hospital. One of them is on a ventilator, and 88% of our people have recovered. Yes, sir.
The death, average age of death has gone up 2 years since last month, right?
I think it was 77 at one time. So the last few deaths we've had 3 centurions that passed.
So almost nobody under the age of 60 is dying right now. Is that am I fair to assume that?
In Beaufort County, or well, we've had under age 60.
Yeah.
Well, we had 3.
And recently?
Well, since the whole thing.
Oh, since the whole thing?
Mm-hmm.
Oh, that's pretty good. Encouraging.
Okay, so here are some demographics of our positive cases. You can, again, find this on the website. Everything is on the website, so you can look at this. And the only thing that I really was going to talk about was the fact that the death and the way they're broken down, the 47 deaths. And then I was going to also let you know that the white population has not been hit as hard for positive cases compared to what I was expecting, and the Hispanic population has been hit harder as far as positive cases. Again, this may be due to people that are coming in to get tested, and targeted testing would have an influence on that. Women are much higher level than expected at 58% of the positive cases are in women. And then the last one is the 65 and older, where 25.8% of our cases are in that age group. This is much higher than the state, where it's about 15%. And I'm thinking that a lot of this has to do with smaller county. When you have a long-term care facility where that population is in higher numbers, is probably what's skewed this in that direction. And then it could also be that, it's not much higher than our expected number at that population either. So between those two, I do think because that 25% of our cases being over age 65 is increasing our case fatality rates. And so I've started to break that number down. I just didn't have the numbers available to show y'all without a bunch of stuff and information. So I'll bring that to y'all next meeting. So looking at the trend in our county, the top graph shows a 7-day average, and the bottom one shows a 21-day average. I include both those because you can see what the week looks like. But you could also then, at the bottom one, get a better feel for the trend that's going on in the county, so you don't get all those waves to kind of confuse your eyes when you're looking at it. So you can see the three kind of waves that we had. We had that first bump, and then we had the big bump, and then we had a slow, gradual third bump. Fortunately, that third bump or wave is starting to go back down, and I'm hoping that we'll continue to do that. And I think that if everybody, be aware of social distancing and make sure you're washing your hands and doing everything you can to prevent COVID from spreading, it will help that number. This is following the active cases in the county, and you can really see those three bumps or waves for the county in this one. And again, fortunately, we're at a point now where we're going down, and hopefully continue to go down. This is one that the state gives us. Instead of doing a daily one or a 7-day average one like I do, they do a week to week, and then they send it to me. I like this for two reasons. It validates the three waves that I saw in our data, and it also includes the long-term care facilities in pink, so you can see the impact that the long-term care facilities had on the numbers in our county. I also had put something here to remind me to say publicly that one of the hardest things that I do at my job is when I get those death certificates and I'm having to look at those people and see those that happen. It's not, death happens, and I understand that. But then to come up here and talk about numbers makes me sometimes feel like I'm not talking about people, but I realize that these are people, and I just want to make sure that everybody just understands that. So this number shows the impact of the different zip codes, and so you can see Washington has been hit the hardest, and this is throughout the whole outbreak or the epidemic. The tabular presentation at the bottom shows the actual numbers, but I included that because some people like looking at it that way, and it also includes the deaths, so you can go in there and see which zip code has been hit and how many have passed in those areas. But that's for the whole time frame and the 200 and something days. So this one here just shows a 2-week window, so you can see which of our communities is being hit hardest at this point. So if you look at that, you can see that Bath and Pinetown have as a decreased number, and you have higher numbers in Washington, Chocowinity, Blunt's Creek. But then the bottom graph, which is a line graph, shows the same data. However, it's over time, so you can look and see where your community was at any time over the last 7 months, 8 months or so. So you can see where you're at right now. So we have a couple of towns, zip codes. Pinetown and Bath are decreasing, as is Belhaven, and the rest of them are all increasing. Again, most of that increase has probably been about 2 weeks ago to 10 days ago, and most of those numbers are starting to look like they're going back down. But that doesn't show very well on here, but it does give everybody an opportunity to look at where they're going or where they're at. Of all the positives that we've had, 17% reported, or 18% reported being asymptomatic. That's a 17% reported being asymptomatic. It used to be 20%, but we're down to 18, which tells me that asymptomatics or people are not coming in to get tested as frequently as they probably did early on, so. And then 60% of those who have tested positive are known to be a contact to somebody else. So they were probably brought in or they were told they were a contact, so they came in to get tested. And you can see they're positive, then higher numbers there. So we did spike in testing in August. And the number of tests has gone down over time, but we're at a steady about 800 or so per week right now. And you can also at the bottom graph see that positivity percentage, and that being at 10 or so has been our high a couple of times, and hopefully we'll be going down from this point. Yes, sir.
When you send that test to the laboratory, what is the cost of the test?
What is well, it depends on where you send it, but the ones that we send to LabCorp, it's $65, I think it is.
So that's about $50,000 a week.
I haven't thought about it. Well, now, we're not sending all those tests. We're not doing all these tests.
Oh,
We did about 150 of the tests last week. Biden did the rest, and urgent care down east.
so this is an
Washington.
accumulation of tests. But when it is sent, who pays the lab fees?
Mostly insurance pays for it. We have two different ways. Insurance pays for the majority of them, but we have a portal that's funded through the CARES Act that pays for uninsured people that get tested. Let's see, there's something else. Okay. So that's it for data. As some other things to get you up on, the annex that we started working on, it's up now, and we're waiting for the city to inspect it to allow us to go in to occupy it. And we're hoping that by next Monday we'll be able to go in there and start doing flu shots out of it, doing COVID testing out of it, and of course when the COVID vaccine comes, we'll be able to do COVID vaccine through there. So it's got a nice little overhang so that people can drive through. We've had our nurses and testers and stuff under tents up until this point. If you drive by Highland Drive there, y'all will be able to see that building up now. So we have a contractor coming in to do some testing throughout the county. The company's called Optum, and they are going to be in Aurora on Mondays, starting today. So they were out there in Aurora. They're testing from 2:30 to 7:30 at the Aurora site every Monday this month. On Wednesdays, out at Bellhaven at the Boys and Girls Club, they'll be testing there from 1 to 6. On Fridays, they'll be at Spring Garden Missionary Baptist Church to test here in Washington from 2:30 to 7:30. And then, of course, the health department, we do ours out between 9 and 11:30 on Thursdays. So we're going to be doing a lot of testing to see. This is in part work with the state. The state asked us about doing the testing, and I said, well, just do it, So we'll be able to see, especially in the Aurora area. It'd be nice to get some more testing done in that area. Our vaccine plans continue. The state sent up the plans to the federal government. The federal government responded back. That was a good plan. There's a couple things they had to work on, and then we are connected to that state plan to start working on our plan here at the county level. I've talked to y'all a little bit about all that, so I don't really have a big update on that, except for we're supposed to be ready to receive it in the state mid-November. That's what they want. They want us to be ready to receive it in mid-November. They expect us to start with some dispensing of the vaccine in December. Again, the big testing, or the big vaccination efforts will be phased in and it'll probably be around March or April before we really get into vaccinating everybody that wants to be vaccinated. But we'll try to make sure that those who need it the most are the ones that are getting it first. Lastly, influenza season is underway. It is a data challenge to me because, like I said, the people in the community are asking me now to try to incorporate some of that data like we do with COVID, but I have a couple of problems. One is that influenza is not reportable to me. It's not something that a provider has to report to me. They have to with COVID because that's the law. So I'm not going to be able to really compare the two. So one of the few places I can compare the two is in those sentinel sites. Because at a sentinel site, when somebody comes in with a influenza-like illness, then they swab them and they test for all the different viruses. And so that should be able to give me at least some pieces of information. The other thing is that I've asked our partners, because we do get the positives from all our partners. We have a good partnership right now with Vidant and Urgent Care Down East and Agape and Washington Peds. So I'm going to try to be able to collect their positive flu data. I need their positive data and their negative data in order for me to have something to compare with. So I'll try to get something out there. It's just it's going to be a lot more difficult, and it won't be as accurate. It'll be as accurate as I can get it. Any questions about COVID?
Commissioner Waters.
Jim, when you look at the number of tests, 19,524, there's no duplication in that number. That's individuals?
No, there are some duplicate. 3 to 5% is my estimate on duplications.
3 to 5%. Okay. The other thing is, how fast are we getting response back now?
Well, 48
Just ballpark,
hours.
48 hours. Thank you.
Did you have? Mr. Dethers.
Jim, concerning the deaths that we've had a rash of in the last 2 months, and most of them being the elderly in long-term care.
Well, 53% are for long-term care.
Yeah,
The other
and most
50
of that in the last few months, right?
Yes,
Is the state of North Carolina investigating these facilities to see if there's a problem that's systemic and can be corrected?
The state does send their licensing agency into those places. I know that they've been here, and they went through it and gave them, a action plan to help prevent the spread. If you go on the state site, you'll see a list of all the long-term care facilities. If you pull up those long-term care facilities, you're going to find that this has happened to a lot of long-term care facilities. This is where it's really attacking. This is one of those areas. So I think that, once it gets in there, it's not a good situation. The whole virus, nature of that virus, and the fact that you have all those vulnerable people, and it's easy to spread. So I don't know. I think that I think everybody's got room for improvement for what they do. But I think I've seen some of the top facilities in this state are still having these widespread outbreaks that occur in their facilities. But the answer to your question is yes, the state does have a licensing agency that does go in.
Do you get a sense that this could be mitigated by better use of PPE?
Well, I guess that's a true statement all the time. The proper use of it is always going to be a risk-reducing factor.
Yeah. In terms of the investigation that the state is making, you may or may not get knowledge of it or receive knowledge of it in the end as an end result, right?
Correct. I don't get a direct report of the facilities.
Commissioners could request that from the state, I reckon.
I guess. I don't know. I've not tried to do that before.
Yeah.
We work with the facilities outside of the licensing way. We deal with them, and they do have certain requirements that they have to do. Once they have the second case in a facility, it becomes an outbreak, and we go in and we do, environmental inspection. We go in and do advice, and then we have a mandatory requirements for testing. The testing is depending on staff, depending on residents. And then we advise them and follow the outbreak throughout the whole course until, again, like 2 cycles of the viruses and no positives in that 28 days.
So if we wanted to know how the any kind of investigation has gone through the state, what the results may be, would we go through you, or quite possibly would we just go straight to them as commissioners?
You go to I'm trying to think what the licensing agency is right now. I'll get it back to you. I'll get back to you on what the name of the associate or the licensing agency is.
Oh, okay.
It's a department within DHHS.
Yes.
It's not within the Division of Public Health.
If you get that for me, I'd appreciate it. You send me an email.
Commissioner Booth?
Thanks, Jim.
Yes, Jim, I know it's early in the season, but have we had anyone yet that have the flu and this virus?
You mean positive flu?
Yes.
None
And
have
the
been
virus.
reported to me yet. Like I said, it's not required to be reported to me, so I haven't seen any at the health department. Next week, I think it'll be, we are going to be starting to test all symptomatic people for both the flu and the COVID.
Okay. Another thing, I called Jim and told him this, but I think we need to know it as a group. Jim, I have had several calls about the service that your people are giving out there that's doing this testing, and people were very complimentary of your staff.
Thank you.
Okay, Jim, you can move to the next item.
All right. So as though y'all wanted to hear me talk some more. Y'all, every year we do, well, I should say this. Every 3 years, we do a community health assessment. And that community health assessment is a survey and try to determine what the biggest health needs are in our county. And, it's a very arduous process. It takes us about 6 to 8 months to get it done. And then we present that community health assessment to you. But every year in between those 3 to 4 years, we do a SOTS report, which is the status of the county's health. So we were supposed to do this like in May time frame, but with COVID was starting out, so it kind of got pushed to the side. We are required to through our accreditation agency, and of course it's a good thing to let y'all know about the status of the health of the county. So I wanted to do a quick synopsis of it for y'all today so that I can check that off my list of things and give y'all some information. So I do have a physical one I was going to give y'all, but then I remembered we're in COVID times. I'm not supposed to be handing y'all paper, so I'll just email y'all this later on. So between 2014 and 2018, this chart shows the leading causes of death in our county. And let me get my notes together. Just in case everybody wonders, I am disorganized sometimes. So the top 2 causes of death in our county is heart disease and cancer. You can see that we're talking about 600 something deaths in that time period. So we probably have about 80 to 90, the rate is about 80 or 90 deaths per year. Then followed by stroke, respiratory diseases, such as COPD, Alzheimer's, and injuries. The third category is diabetes and kidney disease. So I put these up there just to show y'all which ones we're behind on compared to the state, and which ones we're even with, which is yellow, and which ones we're behind, or in front of, or doing better than. So pneumonia and influenza, we've done a little bit better than the state average, and in homicide, we've done a little bit better. We're pretty much even with the state on cardiovascular disease, liver disease, septicemia, kidney illness, Alzheimer's, and HIV and AIDS. And then we're behind on all causes, diseases of the heart, cancer, diabetes, lower respiratory illness, motor vehicle injuries, unintentional injuries, and suicide. So those are our big mortality numbers. We did identify in the community health assessment these top 4 priorities for us to look at, top issues. So access to care to include mental health. Just a couple of numbers to show you. We have only about 67% of the medical providers that we need in our county, and only 49% when it comes to mental health providers. So some of the things the health department did, and again, this is in 2019, see, it's a little bit behind. Healthy Living Clinic moved to 2 days a week so we could see more people that needed care. We continue to operate our services on a sliding scale fee so that people can have access to the care and the services that we provide at the health department. And we've worked with the Beaufort County 360 and other partners to help increase access to some of our partner agencies to try to get services provided. Second factor, exercise, nutrition, and weight. We have about 35% of our population that is obese, another 30% that's overweight, and 48% of people have been told at some time that they are overweight by their doctor. So some of the things that we've been trying to do is diabetes has been our big focus, diabetes prevention program, diabetes self-management education, and medical nutrition therapy are some of the things that we brought in. 71% of the people that went through the program saw a change in their A1C, so that's a good thing when it comes to diabetes. And 64% of them have recorded weight loss throughout the program. Education is the third top priority, and this is unusual that education made its way into health priorities, but it was our whole population that kind of determined that as a factor. And I've always thought that education was an important public health concern, and this year, just seeing what COVID did and its disruption to the school system, you can see that it's even more relevant as a factor now. So a couple of things that we did during the SOTS time frame, we had a task force with the BC 360 that approached and looked at illiteracy, and they did some projects. One of them was, at least at the start of it, was to do drop boxes around the county for books for people. And then the health department started the Reducing the Risk program at the school system. And we're looking to expand more programs that are concerned with health at the school-age kids. The last topic was substance abuse. And that's been increasing even more during COVID. Substance abuse and mental illness has been impacted by COVID. Some of the things that we've done is testing is power, which is used to look at substance users and try to get them tested for HIV, syphilis, and hepatitis C, because it's a mode of transmission is the substance abuse. Then we also started the DAS-10 program, which is a screening program at the jail to try to find out if we can get people hooked up with programs while they're in jail and then carry on after jail. And then, of course, we've had a judicial opioid coalition that was formed. So, again, I just wanted to give you all a quick synopsis of that. A few other quick points of interest as far as the SOTS goes. Medicaid transformation, y'all know that began, and then it was stopped in 2019 because of budgetary reasons. And that was where they were moving from a fee-for-service for Medicaid services to a capitated fund per member per month model. And that is now back on the table to again start July of next year. So y'all are going to hear a lot more about Medicaid transformation occurring at that point. Medicaid transformation is not the same thing as Medicaid expansion. They're two different things. In 2019, we also had a measles outbreak with 1,282 cases in 31 states. 73% of those were in New York City, and of not unvaccinated people. I wanted to bring it up because public health vaccination is an important battle that we're fighting all the time, and people forget because they haven't seen measles and pertussis and that in our society that they think that it's not going to affect them anymore if they don't get vaccinated, but it does. It's still out there. We also saw a vaping and e-cigarette disease come up, and it was over 2,500 hospitalizations occurred and 50 deaths were recorded during that time period. It's kind of taken a back seat because of the COVID, but it's still something that public health is trying to tackle. I think it was a couple months ago, y'all approved the bicycle and pedestrian plan. So that was an important part of getting a more fit environment in our county. And lastly, I just wanted to mention that two of our nurses out of the health department were given the Distinguished Public Health Nursing's honor. That was Sherry Griffin and Christine Wobble. So that's it for the SOX report. Anybody have any questions?
The vaping and e-cig, is that becoming a problem?
Yes, sir. That's a big problem. A lot of people are moving to it, as a substitute for cigarettes, but they're not any safer. I mean, they don't have 200 chemicals like a cigarette does, but they have other chemicals in them. Mm-hmm. And people think that they're safe, so they tend to go towards it. The vaping industry is targeting young people, especially with flavored cigarettes, or not cigarettes, but vaping items. So it's very attractive, and of course culture is part of that play too. So yeah, we're battling, and we are concerned about the increase in vaping.
So it's like tobacco and nicotine, it's tar and nicotine, and that is a carcinogen.
Nicotine is in it, and there's other carcinogens.
And vaping has carcinogens too. And the whole idea is just the inhalation of carcinogens is alien to what our body should be doing.
That's correct. And lungs are one of the hardest places. You can absorb some toxins in your stomach a lot easier than you can in your lungs.
Oh, absolutely.
And we do that all the time with sodas and stuff. So.
Yeah, other terrible things we shouldn't be doing. But it appears that education needs to be afoot.
We did, and last year, I say last year, it seems like it was actually 2019, in response to this, we did I forget what it's called, Remove the Jewel program at the schools, where we went and all the high schools and had a display and let everybody have the opportunity of getting rid of their stuff, and do a lot of education. We did that.
Are you seeing any cases of COPD in very young people, comparatively speaking?
I am not.
Okay.
Not here, I mean Beaufort County.
Thanks, Jim.
Good question to ask.
It is. It could be a question that needs to come up later again.
Any more questions? Okay, you can go ahead and move to the next item, Jim. Thank you.
Okay, this one hopefully will be real simple, easy. Sue Hall, one of our nutritionists in the WIC program, is, after 14 years, is moving out of, well, she's staying in North Carolina, but she's moving down south to Wilmington area. So now she's leaving, and I'd like to ask y'all to be able to announce for the position and hire it because of the freeze that's on right now. This is a WIC-funded position, so it's all state funds and federal funds. There's no county dollars in this position.
Motion to approve.
Is there a second? Discussion. All those in favor, please raise your right hand. 7-0, motion passes. Thank you, Jim.
All right, thank you, everybody, for your time.
Okay, we're up for Melanie Corprew, DSS Director.
Good evening, Mr. Chair and Commissioners. The Department of Social Services is here tonight requesting permission to advertise and fill one vacant position at the department. It's an accounting clerk 4 position, and this position works our front desk and also provides backup for our switchboard and other administrative duties. This position is reimbursed at a 50% rate because it is an admin position. And we are respectively requesting approval to advertise and fill this one position.
So moved.
Is there a second?
Second.
It's discussion. All those in favor, please raise your right hand. 7-0. 7-0, motion passes. Thank you. Next item.
Okay. Next item on the agenda is the annual memorandum of understanding between the Department of Social Services and the North Carolina Department of Health and Human Services. As you'll recall, this memorandum came about out of House Bill 630, Session Law 2017-41, which requires each county to enter into this annual agreement with the Department of Health and Human Services. It also specifies the performance measures we have to meet. For this upcoming MOU, it will be for a period of January 2021 through June 2022. This MOU will have 16 fixed or mandated measures and also 5 what they call growth measures that are from the Child and Family Services Review. These are federal measures that we will work with the state to help meet those measures, but we won't be penalized if we don't meet those. I will say this is I think the 4th MOU we've had since the law was enacted, and I will say this is probably the best one as far as our ability to meet the measures. The DSS board met on October 19th and did vote to send the memorandum of understanding to the commissioners with the recommendation that it be approved.
I have a question.
Yeah.
From looking at this looks to me like just a regurgitation of what's already there.
In the MOU?
Yeah.
So we did have an MOU it was originally scheduled to run July 2019 to June 2020, but due to COVID-19, the department extended that MOU to December. So it's very similar to the one that's currently in place with just a few, it adds one child welfare measure and one child support measure to the mandated side.
But the standards that are presented in there are the standards that already exist. They're just represented here in the form of some kind of a enforcement contract from the state.
Yes.
Okay.
Is there a motion?
So moved.
Is there a second?
I'll second it.
Okay. Any discussion? Hearing none. All those in favor, please raise your right hand. 7-0. Motion. Thank you, Melanie.
Okay, thank you.
Okay, we need Martin. Mr. Martin Johnson.
Have that. Okay. Good evening. Kevin Richards with the Mideast Commission. This is the second of 2 public hearings that are required to apply for community development block grant funds. The purpose of the public hearing is to explain the CDBG building reuse grant and allow the citizens of the county an opportunity to express their views concerning community development needs and priorities. This grant will allow Clean Air doing business as Pamlico Air to upfit an approximately 24,300 square foot building located on a 5.5 acre site at 720 Page Road in the Industrial Park in Washington to create a high purity division air filter manufacturing facility. Pamlico Air commits to hiring 33 full-time jobs and applying for the $400,000 grant. 20 of those jobs, or 60%, will come from persons of low to moderate income status. That's a federal requirement. They propose to invest $467,200 in the renovations and $950,000 in equipment for a total private investment of $1,417,200. The cost of the rehab and renovation is estimated to be $867,200, with $400,000 or approximately 46% financed by a CDBG building reuse.
So that's the outline of the project. Yes, we request public comment.
Need a motion to go into public hearing.
So moved.
Need a second?
Second.
All those in favor, please raise your right hand. All those opposed? 7-0. Motion passed. Anyone here?
Motion to come out, oops.
Oh, look, that's somebody going to speak. Oh,
This is strictly for the public hearing for the CDBG grant.
Oh,
Motion to come out of public.
second.
Second.
All those in favor, raise your right hand. We're out of public hearing. Okay, Martin?
That's it, back to Kevin again. That's it? You don't have to ask them for a motion to...
Well, we need a motion to adopt a resolution to apply the program manuals with the various federal plans and the legally binding commitment.
Motion to approve.
Is there a second?
Second.
Discussion? All those in favor, raise your...
Discussion.
Okay.
Is this going to take any county money?
No, it is not.
It is not. Okay. Thanks, Kevin. I hold you to that.
Yeah, all right.
All those in favor, please raise your right hand. All those opposed? 7-0, motion passes. Okay, Mr. Johnson?
Okay, the next item is item for decision, acceptance and creation of a budget amendment for the Duke Energy Carolinas Site Readiness Program grant for the Aurora Industrial Park that the board approved to apply for back in June 1st, 2020. Basically, the grant from Duke is to assist in covering engineering costs for the work done by the East Group in coordination with the Golden Leaf and the North Carolina Department of Commerce Industrial Development Fund grants to install infrastructure in the Aurora Industrial Park. So the request would be for a motion to approve accepting the check from Duke Energy and to create a budget authorization amendment.
Is there a second?
Second.
Discussion? All those in favor, please raise your right hand. 7-0, motion passes.
Thank you.
Thank you, Martin. Ms. Radcliffe? Glad you have you back.
oh, thank you. It's good to be back.
Hope you're doing well.
I am doing well. I've got one complaint about my whole medical leave. I asked my surgeon while he was in there doing my neck surgery, while he was in the area of my throat, to get rid of the frog that resides there every time I do public speaking. It didn't work.
It didn't work?
It's
Okay.
right there, and it's like a bullfrog tonight, so. Okay. Hope everybody's doing well tonight. I want to start off this evening with a little discussion about sales tax. And I think I'm just going to skip over this and come back to that one. I want to start with this big, beautiful graph at the top, and hope you can see that. It gets really small on the screen. But of course, our manager did a really good job. He developed this last month, so I had the easy work of just going in and filling in the most recent numbers, which are the November distribution numbers for the sales month of August. And what this graph shows is really 6 years of sales tax history. And what's interesting is that it's pretty much consistent with the exception of that big green V you see at the top right. And what that big green V is the sales tax during the COVID months. So you can see if we go back to the beginning of the graph, I'll try to use a little pointer here. You've always got, it seems like, this little spike here at the beginning of the year, and this happens around March. And what this is, if you'll remember, there's a 3-month lag in our sales tax collections that happens at the vendors at the point of sale, and when we actually get the money from the state. So that distribution that we get in March, that's the December sales. So that's the Christmas sales you're seeing right there. It always spikes up like that. And you can see consistently year after year, with the exception of that orange year down there in 2016, I'm not sure what happened there, but we always get that big bump. And then you get that lull where it drops right back down for a couple of months right here. And, you know, we could probably attribute that to, you know, folks recovering from their Christmas spending and trying to pay off those bills, and it's cold and people are inside. That's what I think that is. And then generally, year after year, we'll get a bump. You see how we've always gotten a bump right here, right back up? That would be, that is our June distribution, which represents the March sales. So it's springtime, spring is sprung, people are out and they're buying again, they're at Lowe's getting all their spring flowers and whatever they're doing, they're kind of getting out of the house again. And then it kind of tapers off and goes just a little up and down from there. Well, like I said, if you look here at this green V that goes up and down, that is a representation or a picture of Beaufort County sales tax for the 5 months that we have collected sales tax for COVID. And those months would be April, May, June, July, and August. So we don't know yet what September and October are because of that 3-month lag in sales tax, okay? But as you can see, we had the biggest month right here at this peak at that top that Beaufort County has ever had in the history of getting sales tax distributions. That was the September distribution, which would have been the June sales. They were over $1 million. Normally, they would probably, I say, average around $750,000, $800,000. So we have to ask ourselves, what caused that? And we really think that what would have caused that were those stimulus checks that went out. And then if you think about the timing of the reopening of North Carolina's economy from the shelter in place, we were in phase 2 at that point, so people were getting back out and spending. And then from there, the last 2 months, which is our October and November distribution, we have fallen back off to something near close to where we were last year. So having said all that, you know, seeing an inverted V like that makes it really difficult to really know, you know, what sales tax is going to do in the future, for me anyway. We've gotten some really good reports on the economy. Commissioner Waters shared with me an article from the, I believe it was Wall Street Journal, where, you know, spending was up in September. Of course, we won't get those distributions until December, but that, you know, that's a good indicator. Unemployment rate is stabilizing. It's, you know, down. There may be a second stimulus package coming. We don't know about that. So hopefully there's some good indicators that, you know, our sales tax numbers will hold really well. If you go down and look at the graph I have there, what I was trying to show here is I was trying to show for the 5 months that we have that were COVID months for sales tax, what our revenue was this year compared to last year. And you can see that we're up in total for the year 8%. So that's very good. We've got an extra $300, almost $42,000 that we've collected this year during the COVID event than what we did compared to last year for those same 5 months. So going back to this first slide that I skipped over, so as a finance officer, what I'm always concerned about is that our actual revenue is coming in at what I budgeted or we budgeted, at least at what we budgeted or above. And what this demonstrates is that, We had 1 month, that first month in April, where it was off, it was down 10%, but every other month, we have met our budget number or exceeded it. And if you look at those last 2 months, July and August, which are the 2 months that are in this new fiscal year, you'll see that budget amount is a lot lower. And that's because, based on some guidance that we received from the League of Municipalities, the association, we made a conscious decision that we needed to lower our budgetary sales tax estimates by about 20% just to be safe, and that's what we did. But of course, that's not what we're actually realizing. We're realizing some of the highest sales tax numbers that we've ever had, which is a good thing. We've been very blessed. I threw this in there because I just thought it was interesting. Each month when the association sends out the sales tax numbers, they will let you know what's happened statewide. And then I just wanted to kind of compare statewide average of what everybody else on average was seeing compared to what Beaufort County has seen. And you can see the very first month, April, when the COVID event kind of started, the statewide sales tax was down 13%, ours was down 10.5%. And then there starts to be a gap between what the statewide has happened and what Beaufort County has realized for our numbers. And you can see May, statewide sales tax was still down 4%, we were up 4%, so that's an 8% kind of a swing there. And then for June, that's when we talked about how the stimulus money got into the economy. The economy was starting to reopen in North Carolina, the shelter in place was no longer in effect. That's when we really saw those 2 months with the really high sales tax amounts. But still, ours was much higher than the state average, as you can see there in June and July. And then in August, which is the sales tax number that we just got at the end of last week, Beaufort County kind of gets more in line with what the state is. And maybe we're starting to see a little bit of normalcy. I'm not altogether sure, but I'm thinking that's what that means. So that was a lot of numbers. Any questions on sales tax? And what, the manager and I have talked about is, we told you initially there was a lot of unknowns. We really wanted to kind of look at it through December to see what the numbers did. And then in January, we would come back with a recommendation on, hopefully being able to abolish the hiring freeze that we have in place, and also maybe looking at doing a mid-year implementation with that pay study. Because if I go back to this sheet right here, this schedule, you can see we're already running a surplus here for the first 2 months of the year of like $612,000 on sales tax. So any questions on sales tax?
I don't know about sales tax, but I think we still need to be very cautious because I think we may be on the edge of where some of these businesses can't hang on much longer, and with the holidays coming up and all that. So I hope they can, and I hope that cushion will be that sales tax. Frank, Commissioner Waters?
The Department of Revenue does not break down in detail how much is for boats and how much is for automobiles or trucks.
No, we have no way of knowing that. We get just big numbers by article, and so that makes it really difficult for us.
I mean, it appears that some of this is very unusual sales numbers, which leads me to believe that that's for, a boat, a car, a truck.
Right. Possibly. I know boat sales are up. I can tell you from personal experience. Boat sales are up. Yeah.
And
Camper sales are up. I'm reading camper sales are up. People want to be able to do outside activities. But that definitely will change. That's, I believe, I know that's short term, It won't be long for that to change. But, yeah, I mean, how much of that are those large purchases? We don't know. We don't have the numbers, that detail of a breakdown of the data to be able to analyze that.
Thank you.
You're welcome.
Thank you, Anita. We got, Hood, we brought in an item for you.
Oh, yeah. This purchase, $52,730 for a business communication system for the health department, I guess. On the sheet, it says sole source justification form. It says provided detailed information about why you need to acquire these goods. Has the department bought the goods in the past? No.
Well, the department hasn't, but the county has.
Were alternative goods evaluated? No. And I just wonder, we're doing a sole source purchase of $52,000 without looking at alternatives.
Right, so this is the same system that we've put in everywhere else in the county. This system right here is currently at DSS, it's in the Seaboard building, it's in the sheriff's office, it's in this building. So it's really more of an interconnectivity issue. We need to go with this vendor so that this system will integrate and work together.
Okay, well, that wasn't presented anywhere in here. It says, no, you didn't do an evaluation. You just gave me an evaluation.
John, do you got a question?
One other question, though, on the same issue. It says that, and I didn't keep it here, but it says that this is not being bought from the manufacturer, but rather from a distributor. And there are other distributors of that same system in the state. So I was wondering if we had entertained any of their bids. Or are we buying this so that this unique business in New Bern is going to service the whole county system?
Brian, you can answer.
Oh, yeah. Thanks, you're helping me.
That is the current vendor that services our existing system, the system that is at DSS, the system that's on main campus. So they are our vendor that handles that. They handle all the maintenance for us. And this has been a project that's been going on for the last 2 fiscal years. Essentially, the backbone of the system is in there, and it's now time to upgrade the controller, and which brings it up to the latest.
Mr. Chairman, I would just feel better, like John says, if we had done a comparison with another vendor to be sure that we're getting a competitive price.
I think the worry that I would have with that is if you have 2 different vendors with the same system, if you were to ever have an issue occur, I think there'd be a lot of finger pointing. I think it just makes a lot of sense in this case to use the same vendor.
Well, once again, it's not good business to go to single vendors. I understand what you're saying, and just because you want to purchase from this outfit doesn't mean that you don't do a price comparison. That's just good business to know where you are, because you can't tell me that you've got a competitive system. This is a lot of money for something that looks to me like somebody cramming in some modules and walking away.
Do you have anything, Brian?
77 phones and some other equipment, so. Thank you.
Thank you, Anita. Brian?
Were you going to act on this one?
Well,
So moved.
is there a second?
I'll second.
Discussion.
Discussion, this is a bad way to do business. It is definitely not good practice for the county, because we have no idea how much we're being overcharged for this particular system. Just having comparison numbers would give me a feeling of comfort, so I'm going to vote against it.
Any more discussion? All those in favor, raise your right hand. All those opposed? 5-2, motion passes. Brian?
Thank you, Mr. Chair, members of the board. What you have in front of you tonight is a resolution to approve articles of association and an agreement with the Rivers East Workforce Development Investment Consortium. Jeannie Bowen, who is the Workforce Development Director, is actually here tonight to give you a short presentation about the Workforce Development Board. Essentially, what we're asking you to do with this, the name of the the Workforce Development, actually, the Workforce Development Board is now called Rivers East Workforce Development Board, and was previously Region Q Workforce Development Board. So they changed the name, which goes along with that, the consortium. So this would change the name of the consortium as well to be Rivers East if this board approves it and the remaining boards that are a part of that consortium approve it. And then it would also appoint the chief elected official to that. And then traditionally what that has done is that role has been delegated further down to the county manager to serve on that consortium board. So I would actually turn it over to Jenny and let her make her presentation. Yes, sir.
Have the other 5 counties met yet?
Jenny would be able to tell you that. I don't know.
3 of the 5 have met. I have the 5th one on Wednesday night. 3 of the 5. You guys are the 4th. Yes.
Okay, you may go ahead.
Thank you. So thank you, Chairman Edmonds and Commissioners, for having me tonight. As Brian said, I wanted to give you a brief update on what's going on with the Workforce Board, some of the activities that are going on, as well as to bring this article.
I think, did y'all lose? Okay, she should be pulling it up for you.
Okay. I've been working sometimes off the PowerPoint, sometimes not. I'm good either way. Okay, perfect, thank you. So you should see Rivers East Workforce Development Board does serve Beaufort, Bertie, Hertford, Martin, and Pitt counties. We are a division of Mid-East Commission. Oh, she's going to change it for me? Okay. And so basically what we do is serve as a point of contact for business, industry, and public sector to communicate their workforce needs. We're really that convener and facilitator with a lot of different agencies. You hear workforce a lot these days, and everybody wants to be a part of it, so that really helps us to be that convener and facilitator to get everybody moving in the same path. We work with the local community colleges when they're looking to develop new training. We do planning, oversight, and evaluation of our NC Works Career Centers. We also coordinate with economic developers like Martin. We work on multiple projects together, and as well as local grant applications if there are items around workforce. We do have 4 NC Works Career Centers. Would it be helpful for me to say next slide? Okay, next slide. We do have 4 NC Works Career Centers that serve our 5-county area, Beaufort, Hertford, Martin, and Pitt. We are reopening a part-time facility in Bertie, hopefully next week, at the Martin Community College Bertie campus. Our centers did close due to COVID in March, and they did reopen by appointment only on October the 12th, and so we're following the phase plan for the governor and planning towards the end of the month to reopen to the general public without appointment. That's it. Mm-hmm. So just some of the services we offer is obviously career services, referring people to jobs, helping them learn about training that's available, as well as resumes and interviews, helping them prep for those. We also have funding to help with classroom training for individuals who are interested in attending community college, on-the-job training, as well as paid work experience and on-the-job training and internships. For employers, we do candidate pre-screening, job fairs, incumbent worker training grants, work opportunity tax credit, and federal bonding. So there's lots of services that go along with inside our building. Like I talked about earlier, the convening and facilitating, we do partner with a lot of different agencies. Many of them are associated with the county, so your local school system, community college, universities, economic development, our local community-based organizations, local governments, chambers of commerce, Department of Social Services, vocational rehabilitation, services for the blind, and those are just a few. We partner with a lot of different agencies that, again, are all looking at employment and training opportunities, either for the general public or for their particular group that they serve. So just a little bit of the numbers from last year, and again, we were closed, just providing virtual services from March through June, but we did serve in our center here in Beaufort County over 2,500 individuals last year. 55 adults and dislocated workers and 37 youth actually received training services, so there were training dollars spent on them either in the classroom setting or on the job. We had 566 local jobs posted. We also, in special projects, At Beaufort Community College, we have a program called Finish Line Grant. It's a governor's initiative that helps individuals who are at least 50% of the way through their two-year degree who have a financial emergency. It provides them up to $1,000 a semester to help them overcome those emergencies. Generally for us, that's been, example with COVID, people lost their jobs or their hours got reduced and then they couldn't pay their rent or they couldn't pay their utilities. And so these funds are used for things like that. We have awarded $30,000 in 59 grants to 35 different community college students with Finish Line Grant, and we're hoping to get those final numbers soon as to how many of those have actually completed that degree, how many of those have completed because of those assistance. We also purchased virtual career fair software during the pandemic so that we could continue to serve our employers and our job seekers to help them match, as traditional career fairs have not been an option. We hosted one on healthcare, one on advanced manufacturing, and one that also included community resources. We have a fourth one that is coming up that is planned right now in December. We're finalizing the date on that. That will be a second chance job fair focusing on former offenders. We also added service options so that we could serve customers by text, by virtual chat on ncworks.gov, as well as an 855 number. That was just to help us keep in contact with our customers while our buildings were closed. In addition, part of the comprehensive economic development strategy that Mideast Commission does every 5 years, we took that and actually built a regional collaborative strategic plan around that for everything from small businesses to infrastructure to workforce, just trying to build that collaboration across the region so that we're sharing best practices across all the counties. And as a part of that, we've launched a tool called Same Page. And if you guys are familiar with Jamie Heath, who worked with Mideast Commission, Jamie's the one who's running the collaborative strategic plan and the Same Page tool for us. Just a little bit about our board. We have 19 members on the Workforce Development Board. Every county of our 5 appoints 2 private sector members. Your private sector appointed members are Jenny Brown with Vidant and Mary Pinkston with Iconic Marine. In addition, there are 9 other seats that are required by federal law. So we have, that represent Beaufort County, Kim Toller with Nutrien represents apprenticeship. And then on the regional level, we have Trey Goodson with NC East Alliance for Economic Development, Larry Donnelly with the Division of Workforce Solutions, and Lynn Hodges with Vocational Rehabilitation. So the workforce, just to give you a real brief, the Workforce Board did update their purpose statement and their strategic vision last year. So as part of our rebranding initiative, this was one of the things they've done. And so they've determined the purpose of the board is to provide regional leadership, guidance, and support to meet the changing needs of our communities through strategic innovation and collaboration. I am proud to say that over the last 3 years, we've brought in over $2 million in special grant funds, and a lot of those are that innovation. Because we don't get huge grants, we get small little grants. So it takes a whole lot of those to equal up to $2 million. As far as strategic goals, we did try to narrow that down to 3. One of those is really to provide a lot of training to our Career Center staff because we realize that they are the front line to our customers. And so if they're not providing good customer service or they don't have the knowledge they need, then our customers are not being well served. The second is to increase public awareness and recognition through a rebranding effort as part of what Bryant said. Bryant said changing from Region Q to Rivers East. And lastly, to increase our community and business engagement to get more people interested in and using our NC Works Career Centers. And so lastly is just a little discussion about the rebranding and the updating of the consortium agreement. And again, we did change January 1st. The board changed their name from Region Q to Rivers East. And so just a little bit about the consortium itself. It is the county commissioners in the 5 counties, and that was an agreement to be legally responsible for certain workforce development programs. And that is, the county commissioners also are the ones who select the administrative or fiscal agent, which is Mideast Commission, of which Mr. Booth is a longtime member of our board there. And then we also have the consortium members meet at least annually, and we do recently have been meeting more often than that, just to discuss issues and talk about topics that relate to that. And they also provide the direction for federal and state programs for us. So the Articles of Association that you are looking at tonight they were last updated in 2015. And the changes that we are requesting is literally just a name change from the Region Q Workforce Investment Consortium to the Rivers East Workforce Investment Consortium, just to keep those consistent. And so as Brian said, the two action items are asking to approve the resolution, which if approved by all 5 counties, would change the Articles of Association. And again, I've already met with Bertie, Hertford, and Pitt. Have you guys tonight, and Martin County on Wednesday night. And then also to appoint the chief elected official for the consortium, which historically has been served by the county manager. Any questions? That was a lot in a short time. I know you guys got a lot of presentations, so I'll try to roll through. Yes, sir.
What is your read on the employer needs in this county?
We are seeing an increase in employer needs, but we're also seeing an increase in individuals who are exhausting their unemployment benefits. And so we are actively working right now to make that match, because we are still seeing that we have a lot of employees who have not been able to go back due to childcare issues or those type things. We've also had a lot of employees who some of the jobs just haven't opened back up, or they haven't opened back up at full capacity. When you look at manufacturing, while manufacturing itself wasn't necessarily affected, sometimes the suppliers down the line have been affected, and it's slowed. So we're seeing some of those ebbs and flows, but we definitely still have a workforce need here, especially when it comes to manufacturing.
Okay. So the employers have positions they need to fill.
Yes.
And aren't able to do it. Right.
That is
Okay.
correct.
So also, of the 566 jobs posted, how many did you fill?
That's always a good question. Unfortunately, our data doesn't really give us that. I can tell you the percentage of individuals who went to work after they came to us, but I can't tie it directly to the number of jobs that were posted, unfortunately.
Okay.
What action do you need tonight? I mean, I think you said that the managers of the 5 counties are still on is that the executive board?
Consortium.
Consortium board. So you need some action on both of those items for that?
Yes, sir.
Okay, which you need first? To change the name or to?
Change the name first. To approve the resolution to change the Articles of Association.
So moved.
Second.
May I ask one question?
Sure.
What is the percentage that you said you could tell us of the people who came to you and then went to work after they came to you?
The total percentage at the end of so our measures are second quarter after the last time they saw us, so there's a lag there. But that was about 93%. And that's for the region. That's a region-wide total.
We got a motion, I believe, a second. Do we have? Okay. Discussion? All those in favor, raise your right hand. Motion passes. What was
Now
your
make the motion that the manager serve on the board.
Second.
Discussion? All those in favor, raise your right hand. 7-0, motion passes.
Thank you very much.
Brian?
Thank you, Mr. Chairman, members of the board. This item is to discuss with you the Health Department generator and automatic transfer switch. As you recall, at the last meeting, you approved installation of generators and automatic transfer switches at the Financial Services Building and the Administrative Maintenance Building in support of emergency operations and resiliency. That funding was created by the CARES Act funding. And during that conversation, we talked about additional emergency operation and resiliency needs. The staff in the Public Works, as you know, has been out, so we don't have that final report for you that we'll bring to you next month with some additional opportunities. But as you'll recall, I did talk to you about that we had submitted to the state under a mitigation plan, under a grant process there to try to get a generator and an automatic transfer switch to run the health department. That grant was submitted 6 to 8 months ago. We finally got word back from them a couple weeks ago that it was approved at the state level, but when it was sent to FEMA, it was denied at the FEMA level. What I'm asking you to do, and you'll see the information that was submitted to the state and to FEMA about getting a generator and transfer switch to run the health department. You'll see the reasoning on the page, to coordinate the health EOC to be able to continue operations there for emergency response, to allow the environmental health to continue to do their things in recoveries from disasters because they have to keep sanitation up. And then it also would allow the clinic to return to normal even in a situation where power was not there. So what we're asking for you to do, what I'm asking for you to do, you'll see the breakout of the money that's been allocated so far, and what I'm simply asking you to do is to approve $89,000, set that aside so that we can come back to you in the next board meeting with final quotes on that from vendors to put in a generator and an automatic transfer switch that will run the entire health department. So that would be our request to you.
That is just set aside for it when you do the bid or whatever you.
Yes, sir. Again, with there being some delay in the public works and maintenance staff right now, they're working on that process, but they didn't have it quick enough to be able to get it to this meeting. So I'm simply asking you to set those funds aside, that $89,000 aside, and say this is what we're going to use to do that. Simply put it aside.
Motion set aside the $89,000 until further review.
Is there a second?
Second.
Discussion? Okay, John.
Brian, why did FEMA deny it?
I have no idea, but
They don't give you a rationale?
My rationale is there are way too many forest fires going on in California, and they are looking to cut money just as fast as they can because they are spending it left and right for disasters. I mean, we see that. We've seen that for the last couple of years. There has been a tremendous amount of disaster response, and it just looks like they're cutting back on stuff. And I get it. I mean, they only got such a big pot of money. That's just a guess, though.
All those in favor, please raise your right hand. 7-0, motion passes. Ladies and gentlemen, we're going to take a short recess. We're back in session. Thank goodness. And Commissioner Richardson, jail door.
Well, we need a report on the status of the jail repairs.
So I have a report from Christina. She sent to me, said regarding the locking update. MTS personnel returned to the detention center on Tuesday, October 27th and Wednesday, October 28th. All outstanding items were completed except for 4 locks on 4 mechanical access panels. That's our area where in the chases where the mechanical access is. That was in B block and G block. When they tried to install the detention grade locks on those existing frames and access doors, the existing structures were unable to support the new locks. So MTS is looking for replacement options for those 4 frames and doors that will support the new locks and return, and they will return to complete the installation. So those are the only outstanding items that are there, those 4 access panels.
Well, thank you. At some point in here, because of actions of the sheriff and behavior of the sheriff and the chief judge, we're going to need to come to some kind of a method of bringing this whole thing to a close and saying this part of it is over with. And I don't know just how we do that, but it has to be done.
We actually issued a letter that Friday. I issued a letter to the sheriff's office saying that the project is substantially completed and we are now turning it back over to you. That was that Friday afternoon.
Okay, that satisfies me. I just wanted to be sure that this wasn't something that was going to live forever.
No, so the only, like I say, those only are those four locks I'm working on.
And you don't have a response from him today?
I don't have a response from, when you say him, the sheriff?
Yeah.
The only response I have from him is relating to your other request on the Hamilton investigation.
Gotcha.
So I do have that one.
Do we know if, was it DHS came out and inspected the jail again? Wasn't that part of the judge's order?
Well, DHS, they're going to come out and inspect sometime. They do it twice a year.
But I thought his letter said next 30 days.
Well, you can't order from the jail.
Okay.
I am not aware of DHS coming back out. Typically, we get notification once they come, and they'll say, here's the report, but I haven't seen anything.
Commissioner Richardson, Brenda Hamilton.
Okay, a report. I believe the manager says he has it on the status where we are with the Brenda Hamilton test work.
I did. I received an email this afternoon from Chief Deputy Rose, and this was from the forensic folks at the Maple Center in University of Florida. This was an email back to Lieutenant Van Landingham. It says, just wanted to let you know that I got some good reactions from the clothing, one from the jacket, left cuff with obvious bite marks, and the backs of both gloves, saliva stains. I took the clothing outside to examine and sample. The saliva stains are more apparent in bright sunshine than just about any other kind of light. The previous lab sampled the fingertips of the gloves and other areas of the jacket based on ALS information. I'm not sure what ALS information is. So I'll send them off tomorrow and should have data back Friday or Monday. So they're continuing to work that. It sounds like in this reading, she seems to be positive that they've found something. Now, whether they're able to match that, she feels like they found something additional that the other lab had not been able to find.
Thank you.
Commissioner Richardson, School Board report.
Well, my understanding from the clerk, and she can correct me if I'm wrong, is that while the school superintendent admitted, because we're past October, so if you're past October, the county commissioners, we do our budget with the school board, and that's complete by July the 1st by law. The state budget is on the same as the federal budget, I believe. Is that correct?
Federal budget is
October, right, and the state budget is the same, isn't it?
State budget is July 1, June 30.
Same as ours. Okay, so the state budget was complete on July the 1st, and the federal budget has to have been completed by October the 1st. So the school superintendent admitted that he had this information, but for some reason I get feelings of Jeff Moss in this, of the dog ate my homework, because he has come back and told us that he doesn't have the information to give us, that we're going to get it next month. And what he's doing is dragging his feet to get as close to the annual budget as he can get. But he needs to be a little bit more candid with his commissioners, and he also needs to present us with a budget in a format that we can understand, because I asked for these budgets to be, if you will, on the same pattern, for lack of a better word, or the same system or the same organization, so that we would be able to make comparisons. Now, what's going on here is Beaufort County has never asked before in the 24 years that I've been here for all three of these budgets. And the reason I'm asking for them this year is there's a lot of appropriations from the state. There's a lot of appropriations from the feds. And if we don't dig around in this information, I suspect when we do dig around in this information, we're going to find that there are a lot of surpluses. And this is going to be an advantage to the citizens of Beaufort County when we start doing our budget. So I'm disappointed that the dog ate his homework, but the school superintendent really needs to become a little more candid in dealing with his commissioners.
Commissioner Richards on Republic Service Handbook.
We can probably include this with Frankie's discussion better than I can do it here, but I read the handbook. I'm delighted to see the handbook, and the handbook is just what I recall. I don't know when I read it, some years ago, but it takes care of all of these problems that we've been sitting in here and pondering and discussing and all that thing. It's very clear that there's not supposed to be any construction debris handled by Republic Services. It's all contractor debris is supposed to be handled somewhere else. Now, we've all sat here and said we don't mind an occasional 2x4, we don't mind this little thing or that little thing, but anything that has significance to it, the people that are operating these roll-off places have the authority to refuse it. And when people start calling commissioners with phone calls, it's not our job to get up and start figuring out a way to overrule the rule book here, because we all have the rule book now and we all know what it says. So that was the main thing I wanted it for. It's very clear to me what we're supposed to be doing, what Republic's supposed to be doing, and what the employees at these roll-off sites are supposed to be doing.
Thanks. Commissioner Waters, enforcement action for violation of solid waste rules.
On Monday, And I think she's got a photo of it, and you've also got a copy of it. When I went to the site at Beach Ridge on Monday, October the 12th, the attendant says, Mr. Frankie, I want to show you something. And so he walked me over to this bulk container, and he showed me all of the material that was in there. And he says about half of it's been removed by a scavenger or whatever you want to call the person. So I said, wonder who it was. He says, the lady yesterday, it happened on Sunday, October the 11th. She wrote the license plate number. She asked the person not to put it in there. Said, you can't do that. And there was no confrontation. She just said that she did her job, and so she wrote down the license plate number. And so I sent it to Brian and David and asked them if we could send a letter, and take some action against the individual. I think Republic's employee did the right thing. They didn't have a confrontation. And if you were to see this lady, she probably weighs less than 100 pounds. So she's not, and I didn't get a description on who the person was, whether they were male, female, or whatever. But to me, when the attendant tells an individual that you cannot do that, and this is definitely the kind of stuff that we want to, eliminate, it appears to me that we need to be writing a letter to that person, and what kind of action, I think that's up for discussion, but at least a warning letter or some fine. And I believe, David, in the correspondence you quoted maybe $50 is in the state statute, or?
That's a misdemeanor for, that's a misdemeanor for counties. We would have to pass a resolution, an ordinance. Part of the problem with what you're saying, I follow what you're saying, but this handbook says on page 12 of 21, says the company shall promptly notify county, that's us, if it believes that any unacceptable materials have been unlawfully deposited at a convenience center. Upon receipt of such notice, county shall be responsible for removal of such unacceptable materials and all costs associated with its removal and proper disposal. I mean, literally what that means is, I did my job, they dumped it in there anyway, and the county's got the responsibility under this to remove it and dispose of it. Now that doesn't get somebody to stop doing something they're not supposed to do. We can certainly write them a letter, which I said to begin with, but all I've got's a license plate number, and no description for the person. If somebody driving your truck dumps this stuff off, what do you say? You're not supposed to do that, and that's the end of that. But we have nothing that I can find that we have any teeth in it. And if you want to pass a resolution for a punishment, a fine, some minimum amount, put signs out there. You got to publicize it so people understand what's going on. Kind of take the pick.
Well, I mean, just looking at it, it was pretty close to 50% of a bulk bin. And as you well know, it cost us $198 to transfer this bin. And then we also had to pay the weight. Whoever did this took, and I'm trying to remember, what do you call it, the saw where you can just come in here and just start whacking things. I mean, this was in sections of almost 4 by 4. I mean, the timbers holding the tin, it was all in there. It was all in there.
Commissioner Booth, you want to comment?
I just want to ask the council a question. You said that the handbook says that the handbook says that the people done their job and the county have to absorb the cost. Is there any way that the county could pass the cost if the tenant would put the license plate number and we send them a cost, but then you wind up in court 2-3 times a month? How could you handle that?
I think the answer to that is yes, or possibly would be one of the solutions. Your essence would be fine them the amount that it costs you to remove the stuff.
When you say, I wouldn't go as far as the amount to move the stuff, like Frankie said, that bin was half full. I say set a set price. If you got something, if you got something for the person violating the policy. But then again, you got to, where I look at it is you're going to wind up 2-3 days a month. The cost, you're sitting in court every day, so you're going to have a cost associated with that also. So going back to Commissioner Langley again, I was wondering, was the juice worth the squeeze?
Commissioner?
Well, I'll tell you what works, and I've actually done this, and that is it's unauthorized material. You write them a letter. You say you have 2 days to remove the unauthorized material, and then we put the teeth in it that the lawyer's talking about, or then we're going to go the court way. You don't have to take them to court and sue them right up front. But I never went to court when I was doing this. I've actually done this. I never went to court a single time. The letter that says it's unauthorized, you have so long to come and get it and remove it. Otherwise, we're going to take the legal route. And nobody ever refused. Now, they were a little mad, but they never refused. They came and hauled the stuff off.
Commissioner Langley?
The only problem I see with that is the timing of when the truck driver's going to come in and snatch that bin and take it away. So you've given the perpetrator the opportunity to come and remove it, but once he gets there, it's an empty bin.
Well, to go ahead and tell you the rest of how this works. After you do, you take a beating on that for a while. After you do 2 or 3 of these, you don't have to do very many of them. The word gets around, and all of a sudden, you don't have a problem anymore.
Commissioner Waters?
I would just like to refer it to the staff and to our county attorney and see if we can come up with something and pass it at the next meeting. Is that okay with you guys? One of the problems we have, and I eat breakfast with a group, and most of the time there's 8 at the table. And this morning I could not even sit down and order or have a cup of coffee before one of them jumped on me. He went to the Yatesville site, which now we've done away with that bin. So that was on Sunday, and he drove all the way to Washington to Flanders, and guess what happened? They're closed. They're closed on Saturday and Sunday. And so the sooner we can do something somewhere else where we've got control of it, the better off we are. I don't like it when people have to drive to Flanders and take it to Republic site. We've got land at Hawkins Beach, and we're looking at land on the south side. And the sooner we can get to pay for the load, I don't care if it's $15 or run them across the scales, but we need to be moving in that direction.
The only thing that we can take at those locations without getting into a big permitting hassle is woody material and yard waste. This material is construction debris, and we couldn't take that without getting permits from the state, which will put us into a whole nother rigmarole that we've gotten out of out there and we don't want to get back into at White Post. The best solution is education and paying to paint some signs and put them up at places, and going through the hassle of come and get your unauthorized material takes care of the problem. You guys are trying to put everybody's problem on your back. It is not your problem to solve. It is their problem.
I agree. I think the sooner we can go ahead and put some teeth in it, and it's going to have to be some fines written, the word will get around. People are not going to want to throw away that kind of money.
If you go about it the right way, I'm predicting that you'll never have to fine anybody, because it took me, we had about 10,000 acres under lease. In the middle of it, we had a landfill that we leased to the county, and I was responsible for all of this mess. And it took me, of course, I didn't have to work at it full time because I was all over the United States, but it probably took about 3 months, and that was with me working at it half a day a week. So it's not going to take long. You just need to set the example, and you need to stick to it. And if you stick to it, you're going to come out ahead real fast.
I'm not opposed to just issuing a warning letter the first time.
Won't do a bit of good.
Just a warning letter?
Won't do a bit of good. No, it won't
Brian.
do a bit of good, though, because the word doesn't get to everybody. I mean, what I was doing was things like, that's not my trash. You know, who do you think you are? Oh, well, let me see here. I've got your Woolworths bill, and you owe them $380. And I've got your other credit card bill here, and by the way, here's something from your aunt, and on and on. And by the time you give them the evidence, and I'll admit we're dealing with a little bit different situation, but we've got the tag number in this case. And by the time you give them the information, you can't deny that it's your trash. So,
Brian, you had a comment?
Mr. Chairman, thank you. If you'll let the county attorney and staff and us work on that to bring it back to you, what I would probably think would, to Commissioner Richards's point and Commissioner Langley's point, if someone's dumping on your property, you can afford to let it sit there for a little bit and go after them like that. Right, but the problem, like Commissioner Langley said, was if it goes in the dumpster, what's happened is people will go out there, the site attendant will say, I'm sorry, you can't put that in a dumpster. And the person will say to them, I don't care what you tell me, I'm putting it in there. And the site attendants have been told, do not confront people, don't get into physical altercations with them, it's just not worth it. It's not their job to do that. So they'll write it down, they'll take a license plate, they'll do whatever, and then refer it back to us. So my anticipation would be to deal with the problem like you're saying. If I put it in there and you say come get it, it's gone by the next day probably. My guess would be that we would bring something back to you that would say, there is a due process piece in that the site attendant confronted the person and said, you can't put that in there. They said, I'm going to do it anyway. They did it. Take a picture of it, send it to us, and maybe we issue them, based on the board's action, we issue them a $50 fine. Then they have the opportunity to come in and meet with me or the county attorney and explain to us why it wasn't them or how they didn't do it, some appeal process. And then through the statutory authority that you have as a board to pass ordinances, you could say, you owe us $50 or however, but that might be an opportunity to do that. We'll work on something with the county attorney and bring it back to you for your consideration.
Commissioner Waters, is that good? Thank you. Commissioner Dethridge.
Okay. I guess everything I do, almost everything I do in life is First Amendment based. I'm in the First Amendment business, and all you commissioners are in the First Amendment business. In fact, all of you sworn an oath to the Constitution, Bill of Rights, and all of you do believe in honoring that. You all believe in the First Amendment for political speech. All of us. We get to say what we want to say. People need to be able to say what they want to say when they want to say it. And right now, what we've noticed in our nation, in this supercharged political season that we're in, there is censorship. There is a good bit of censorship that is going on right now, and nobody's the benefit of it. No one. If your guy is benefiting from the censorship, maybe tomorrow you will be the one that is being unjustly fouled by censorship. And again, we're all in the business of speaking. And we speak not only for ourselves, we speak for others. So what I've done is I'd like to read a few paragraphs, and then I'd like to read a resolution. And I would like for you guys to seriously entertain this and consider it, because at this point, we are at an inflection point in America where some people do not believe all speech is good. Some speech is less than other speech. And I will defend your right to speak as long as you will allow me to speak as well. And we have to have that philosophy. And if we don't have that philosophy, we lose our republic. We will lose it. It will be gone because every other amendment in the Bill of Rights and every article in the Constitution will eventually fail. You lose your right to speech, you lose your right to your own thoughts. That's the way it works. I think we all agree with that, don't we?
I'm waiting to hear you read the resolution.
Okay, that's great. That's great. I'm glad you're waiting. And I want you to consider it.
Who wants to go home?
What?
Who wants to go home?
Well, Hood's not talking. Hood's a First Amendment guy, too, as you probably have noticed over the years. He says what he wants to say, and I think we all should say what we want to say. When we consider the importance of the First Amendment, guaranteed freedom of speech to speak truths as we know them, think as we see fit, and politically assert ourselves as we are called to do so, we all must be aware that our freedom of speech could be easily lost. Therefore, this most important issue that I bring before this local board in the form of this resolution is to make government bodies and other entities across the state and in Congress and in the federal executive branch aware that they realize there is a problem and that this problem must be corrected to the benefit of the people as per all existing statutes and regulations. At this time, in this hyper-energized political climate, which appears to be ongoing, we, all of us, irrespective of our political ideologies, must not be deprived of our guaranteed right to speech, including and especially our guaranteed right to political speech. All right? I want to read that first for the record, and now the resolution. Resolution support and defend the First Amendment, and in particular, freedom of speech or of the press. Whereas the First Amendment of the Constitution of the United States is not only the First Amendment of our Bill of Rights, but is chief among all amendments of our Constitution, and whereas the First Amendment provides for the guaranteed, unfettered exchange of information in nearly every space and on every platform, where American citizens can extrude the rightful truth from the torrent of spoken words thereof. And whereas the First Amendment also guarantees that the rightful truth of, by, and for a free people expressing their desire to remain free will always overrule an elitist predilection to control the many by the few, and by whatever means necessary, unconstitutional and or otherwise, and whereas the first hurdle for any prospective socialist communist society is to limit all freedoms by controlling the thoughts of that subjected society by any means necessary, primarily by replacing free speech with only the approved speech by the ruling class, aided by speech control and the constancy of propaganda as truth, and whereas the American media is currently an abysmal mess of predominant propaganda, where far more fakery and lies knowingly told are in abundance to the truth, where even the rightful truth is assailed by propagandist media critics, celebrated by the left but otherwise held in infamous repute, and whereas in this 2020 election cycle, the Democratic Socialist media has thrown a continual dark cloak over any news detrimental to their candidates for President and Vice President, Joe Biden and Kamala Harris, respectively. Even the bombshell story by the New York Post, which is supported by some corroborated evidence of Joe Biden allegedly attempting to sell through his son Hunter Biden U.S. government access to foreign powers, even foreign powers who steal trade secrets, export COVID, and are considered the United States' chief foreign rival, China. And we're also in this 2020 election cycle, the Democratic Socialists primarily owned, operated social media outlets, Twitter and Facebook, has often banned speech that they do not approve of, including putting up a dark curtain hiding certain users, such as the White House Press Secretary Kayleigh McEnany and even the New York Post article itself regarding certain news detrimental to their unconditional advocacy for Biden-Harris campaign, alleging the selling of U.S. government access to foreign powers. And whereas, also in this 2020 election cycle, the Democratic Socialists primarily owned, operated social media outlets, whereas since the results of the 2016 general election, when Donald John Trump defeated Hillary Clinton for the presidency, the search engine Google, which controls nearly 90% of our nation's search on the internet, has methodically used their technology to favor more leftist sites, which they favor over internet online publications that support and defend our collective guaranteed right to freedom of speech or of the press. Therefore, let it be resolved that the Beaufort County Commissioners support and defend all speech, even speech that does not comport with our ideals or our ideology, thereby expecting the American media, if it is to be taken seriously as a constitutionally guarded press, to refrain from all manner of propaganda and also support and defend the First Amendment of the United States Constitution. And therefore, let it be further resolved that the Beaufort County Commissioners applaud and support the Department of Justice recent lawsuit, United States versus Google, alleging anti-competitive behavior under Section 2 of the Sherman Antitrust Act, and any other case that is instructive in Google complying in a manner where all speech is treated accordingly in a fair manner. Furthermore, and therefore, let it be additionally resolved that the Beaufort County Commissioners demand that online platforms such as Facebook and Twitter, who need online users to continually build out their websites in order to exact revenue, must adhere to U.S. Code 47, subsection 230, a provision of the Communication Decency Act, which stipulates no provider or user of an interactive computer service shall be treated as a publisher or speaker of any information provided by another information content provider, or forever lose that U.S. Code 47, subsection 230 exemption, and therefore be treated like all other online publications, which are not immune, contrasted against the interactive platforms Twitter and Facebook that are currently immune to defamation lawsuits, copyright infringements, etc. And that's pretty much it. Basically, that last part, that 230 exemption, is something that has been there for a long time, for about 20 years. And what that does, it says they have a carve-out, Twitter, Instagram, all these guys. You know, next guy coming up with a platform. He has that same carve-out, whereas they're supposed to allow everybody say what they want. They can moderate it as per a set of rules, but they can't censor people that are real, that have something to say. And right now, we're finding that Twitter and Facebook are doing that. But if they don't like what you say, they will censor it and say, we think that it is not true, yet they have no guidelines for seeking the truth. In fact, they cannot be the arbiters of what is true or is not true and still get that 230 carve-out. In other words, they'd be treated like every other publication, and they'd have to worry about copyright infringements, which they don't have to worry about now, and they'd have to also worry about defamation lawsuits, which they don't worry about. And we've seen what's happened recently with CNN and the Washington Post being sued by Nicholas Sandmann. He was awarded a bunch of money. And I think you're going to see some other people get sued for saying things that aren't true. Watch Rudy Giuliani in the next few months put a lawsuit on somebody for calling him a Russian agent. Watch it. You can't do that and remain a free people. Now, media, they can do this and get away with it, but they don't have to be taken seriously. Platforms are different. They are regulated. Okay? They have to adhere to this. Any other comments? I know this is an important issue for all of you.
Is that your motion?
Yeah, it's a motion, yes.
Okay, is there a second?
Second.
Is there any discussion? All those in favor, raise your right hand. All those opposed, motion fails. Need a motion to go into closed session?
John, you lost it. Well, I move we go into closed session under the general statute having
He won.
legal.
He won that vote.
Is there a second?
I'll second.
All those in favor, raise your right hand. 7-0.
You're gonna be in Belhaven, I'll give you tickets. From 11 a.m. to somewhere. And at 1 o'clock, that's probably all we'll be going. You're gonna be there at 11.